Hi, everybody. This is Leah Hughes with Mountain Roots Holistic Healthcare. I am the nurse practitioner here. And as always, we are constantly trying to bring you new information and education on all the great things out there that can help you through your healing journey or just help you feel improve your already great health. Today, I am here with Brianna Kraus with Full Circle Acupuncture. She is an acupuncturist with over 10 years of experience. She is a graduate of the Southwestern Acupuncture College. I think I got that right. She is married with two children, and she works with a lot of clients who are dealing with stress, anxiety, cortisol issues, just to name a few, and has a lot of techniques up her sleeve. So today, Brianna's going to tell us about acupuncture, how it works, and what great things it can do, and how adding this treatment modality to your repertoire can really take you to the next level. So today, please help me welcome Brianna Kraus.
Thank you so much, Leah, and thank you for having me. Like Leah said, I'm Brianna Kraus with Full Circle Acupuncture. Some of the biggest questions that I get asked as an acupuncturist is, how acupuncture works, and also, does it hurt? And also, what are the things that it treats? So I'm just going to kind of go through that in that order. So the way that acupuncture works is we believe that we have these energy channels that run through our bodies. And recently, there have been some scans that have shown something that scientists are calling the interstitium. But if you look at a map of those, the interstitium that they're looking at, it very closely reflects the channels that acupuncturists have been working with for several hundred to a couple thousand of years. So,
like, what is the first recorded history of acupuncture use?
There was actually a mummy that was found. I don't exactly remember where, but they found a mummy who had tattoos of like acupuncture points all over the body. The other thing that there were a group of acupuncturists that were studying, they found a lot of like piercings in like mummies' bodies on certain parts of the ear. And they found, I believe they found it was for hip pain, like sciatic pain. And so they started mapping out the ear as a really quick way to do acupuncture that way. So those are kind of the two earliest that I know of.
Where was the mummy? Like in ancient Egypt or in China?
I'm trying to remember where it was. It was more northern, like more like northern hemisphere than southern hemisphere. So I'm going to guess it was probably somewhere in China. I can't exactly remember.
That's okay. And then when did, we were kind of, as we evolved, right? We were cut off from China until, I think we think Marco Polo, maybe, is that correct? Or the Great opened up. So was that around the time that acupuncture kind of started spreading, or was it later?
Acupuncture didn't really come to the US, not even mainstream, but really getting a lot of notice until actually the 1970s. There are lots of different styles of acupuncture. So there's more Chinese acupuncture, there's more Japanese style acupuncture, there's Korean acupuncture. They all have different styles, different flares, different focuses, but it wasn't really well known in the United States until the 1970s. There was a journalist that was following President Nixon. It was Nixon. And he came down with appendicitis. He had to have his appendix removed and woke up in a ton of pain. The pain medication they were giving him wasn't really helping. So they offered him acupuncture as a mode of pain relief. And it worked so well and so quickly and so effectively that he came back and wrote this whole article on acupuncture and his experience and things like that. And so that's when acupuncture started to kind of be brought to light in the United States. So it's a pretty new thing. It's a newer modality in our country, even though it's been, practiced in China for thousands of years.
Tell me, if you said that there originally were different forms of acupuncture, there still is. What is the in America, when you go to acupuncture, what is the predominant style that you're most likely going to be exposed to?
Most likely, most acupuncture schools or teach traditional Chinese medicine. It's pretty, that's the one that's kind of been standardized based on more herbal medicine. So in order to standardize and regulate acupuncture so that they could create schools, so that they could, write standardizing tests once those became a requirement, they based it off of the herbal medicine piece of it. And there are Japanese style schools. There are schools that teach what's called 5-element acupuncture, which I kind of describe as the Myers-Briggs version of acupuncture. And I can go into that a little bit later.
So
but
for those of you who don't know what Myers-Briggs is, that's actually a kind of a personality test. It tells you if you're like introverted or extroverted or perceiving. So you're saying it kind of relates more to your personality type?
Yeah, it looks more at how, a person views the world, how the world perceives that person, how each person is like kind of acts in relationship. So what the 5 elements are is there's wood, fire, earth, metal, and water. And each person, based on their personality type, the things that they gravitate towards, whether it's like a specific taste or a specific color or something like that, they have what's called a predominant constitutional factor. And everyone has a primary one and a secondary one that are more prevalent. And so based on that constitutional factor, there's kind of a system of how each person is viewed and views the world, is viewed by the world, how they act in relationships with different constitutional factors and things like that. So it's much more focused on the person, their constitution, their emotions, things like that. So that was the original. When I first started acupuncture, I was seeing a 5-element practitioner at the time, but I was taught traditional Chinese medicine.
And what does it take to become an acupuncturist? Because I just want people to understand that you guys are very educated and trained and licensed. So what is in a few words, what is your training? What does it take to be an acupuncturist?
So it depends on the track that you take. For if you go there's an acupuncture plus herb component track, and then there's an acupuncture only track. The acupuncture only track, if you go full time, it takes 3 years basically to complete. If you take the acupuncture plus the herbal track, that is closer to 4 years full time. I saw a diagram recently that was kind of listing other healthcare practitioners and the length of their training, and acupuncture is one of the longer training programs that over chiropractors, over massage therapists, over physical therapists, things like that. So ours, I think, if I remember correctly, it was like the second or third longest. So it's a lot of training. We have to learn all of the acupuncture, Chinese medical theory, things like that, point location, what the points do. So there's a lot of learning that system, but we also are trained in different like Western pathology, anatomy, physiology, things like that, so that we can kind of understand both sides of it and then kind of translate it and put them together so that we're able to understand our patients and what they're going through the best. So it is a long and intensive process.
And probably a lot of hands-on training as well.
Yes. Yeah. So my program was I started with acupuncture and herbs and then switched down to acupuncture only. And that program was over 2,500 hours, and over half of that, so a little over 1,200 hours alone, was hands-on and in the clinic treating patients. So yeah, it's not like I graduated and then they said, good luck.
See you later.
Yeah.
Yeah, sometimes.
Yeah.
You have a personal story about how you kind of came into acupuncture and why it's important to you. Do you want to share that with our watchers?
Yeah, absolutely. When I was 16, I came down with a very strong flu-like illness. So think very high fever, very sore throat, body ache so bad it hurt to pull the bed sheets over me, things like that. And it was awful. And I was sick over my 16th birthday. And when all of those acute symptoms went away, my system was just trashed. Like my biggest complaint was that I had no energy. I could make it through school, and then I would come home and just like lay on the couch the rest of the day because I just didn't have the energy to do anything else. And I was a pretty studious person. I would get ahead on my homework, things like that, and I just didn't have that at that time. So went to the doctor, a doctor that I really respected and trusted, and he ran all sorts of tests. I know he tested for mono and anemia, and I'm sure lots of other things. I can't really remember. Those are the two that I remember. And everything came back normal or negative, which is great, but also it didn't give me any answers and I didn't feel better. So we started looking at other alternatives to see, what could be done. And my mom was seeing an acupuncturist at the time, and she suggested, why don't we try this? If it doesn't work, we'll try something else, but maybe let's just start here. And so I went and tried acupuncture, and not only did I feel, I mean, the biggest thing was that I felt better within 24 hours of seeing her. But the other thing was that was kind of the first experience that I had with not feeling like believed or heard of what I was going through. My doctor was like, I don't know how to help you because my tests say that, like, not that there's nothing wrong with you, but
I think at least that he acknowledged that he didn't have anything left in his toolbox for you is actually like a great experience for you, because I see clients all the time who sometimes get gaslit by conventional medicine. Instead of the doctor admitting, it seems like there's something wrong with you, I just can't figure it out, they kind of turn it back on the client and say, well, there's nothing wrong with you, it's in your head, here's a referral to psychiatry.
Right. That is
I
very
think
true.
that's a great thing that your doctor at the time actually acknowledged his limitations to you.
Yes. Yeah. And I was 16, and he was a pediatrician. So I think he was kind of like, it's kind of getting out of the realm of his expertise. And that is a really good point that, I do really appreciate that he was like, I don't know. I know that something is wrong. I just don't know what it is. Cause then it did kind of give me the freedom to be like, okay, we've exhausted that option. What other options can we pursue? So I think, had I been stuck in, referral after referral, not, being believed by people, things like that, I think it would have, that process could have gone on a lot longer.
Yeah, and had some negative psychological impact as well.
Absolutely.
So that first experience with acupuncture kind of helped you get over that fatigue that you were having from that illness and move forward, and then kind of sparked a interest in acupuncture.
Yeah. So what we ended up figuring out was, and like I said, she is more specialized in the 5 elements. So she was focused more on the emotions, the kind of the underlying personality traits that I have that was feeding this disease state, I guess. And what we figured out was that whole summer, my birthday's in late summer, and so I got sick right before I went back to school. And that whole summer prior, I had just been going and blowing. Like, I think I had been home maybe 10 days, like the entire summer before I got sick. And I was heading into a really stressful, rigorous academic load in that year. And I think there's a lot of things that was making me stressed out, that there are a lot of things that I was really anxious about, but because I was so busy, I wasn't acknowledging that, I wasn't dealing with it. I also wasn't giving my body the enough time to rest and recuperate between trips, between events, things like that. And so eventually my body was like, okay, we need rest. And so we're going to make you sit down.
I see that in clients all the time. It's like, eventually your body's like, there's no gas here, I gave it to y'all.
Yep.
So sorry about your luck, we're done.
Yes.
And I see that frequently in like adrenal fatigue, which is a cluster of symptoms associated with kind of that burnout that causes people. And I think you probably see adrenal fatigue as well. You said, what sent you seeking was kind of that overwhelming fatigue. And if you can kind of touch on that, because our clients, I think sometimes that's a main reason people come to see practitioners, but also I think a reason that sometimes we don't, because we think oh, we're just tired, when there's a lot more going on. So tell us a little bit about how acupuncture can help combat that fatigue that we, have for a reason, or sometimes we don't know what the reason is. We're seeking the reason. Tell us about how acupuncture works for that.
Absolutely. So the great thing about acupuncture, and something that as a practitioner can get a little tiring to say sometimes, is like there are so many things that can kind of layer on top of each other and create, a cluster of symptoms.
I
And
agree.
so
I don't think there's a magic bullet. Like it's
no, there's
always,
not. There's
no, there's
not.
not, right? Like it's always there's kind of like multifaceted things going on at once. And that's why, why I try to do a holistic approach, because, you can't just fix one thing. It usually doesn't fix everything.
Totally. And so, for example, like when, when let's just say someone for whatever reason isn't sleeping well. Sometimes, it's they have trouble falling asleep, and sometimes they have no trouble falling asleep, but they wake up multiple times a night, or they wake up at some point in the night and they can't go back to sleep. Well, that starts, there's so much like healing and restoration that goes on while we sleep. And so, not intentionally, but we're kind of cheating our bodies and our brains out of that rest and restoration time. And so
Clearing. I also say cleaning too, because
yeah,
nighttime is where your body cleans all the debris. So like all
yeah,
the, poo that your body's generating, that's not, it has to go somewhere. It has to get cleaned out. And if you're not sleeping, we're not cleaning that out. So kind of imagine certain things like your drain or whatever, that if you don't clean on a regular basis, what that looks like. So basically
yeah.
what you're saying that if we're not sleeping, our body is getting kind of junked up in certain areas because it's not performing what it's supposed to be doing when we're sleeping.
Exactly. I'm gonna add that cleaning piece to it, to when I talk to people about that too. And so then it kind of starts a spiral of like, well, I didn't sleep well last night, so I feel like I need extra caffeine, or I'm craving sugar more to give myself that energy to be able to, get through work or entertain my kids, or, whatever. But then that also puts a different, that adds a layer of stress to the body. And then, and then we crash, and then we're like, I'm so tired because I didn't sleep, and now I need, more caffeine and more sugar and things like that. And then, because we're not potentially, fueling our body correctly, then, one symptom that I ask a lot of clients about, that they might not, no one talks about this as a symptom, but I do. It's like, does your body feel heavy? Like, particularly your arms and legs, of like, does it feel like if I asked you to, walk up the stairs of your house, if you have, stairs in your house, if I asked you to walk up 10 steps, does that feel doable, or does that feel like I'm asking you to walk up 10,000 steps? Like, it's that type of, just like, I'm completely drained. I don't have any gas left in the tank.
Mm-hmm.
So, and then that can affect our mood. It can affect our digestion. It can affect our libido. It just like
Yeah.
spiders into every aspect of our life and our health.
So then what does acupuncture do for that? Or how would you address that?
So with each of those energy channels that I was talking about earlier, the way that I found to describe them to people that makes sense is kind of the image of a river. And so, you want, in order for a river to flow correctly and, well, you need to have, a point A and a point B. You need to have a direction of flow. You also need to have nothing really like blocking that river. So like, if you imagine like a boulder falling in the river, now all of a sudden it's condensed. Let's just say the river is this wide, and then the boulder, takes up this much space. There's much less room for that same amount of water to flow through that area. So, that might cause symptoms like pain or headaches or irritability, constipation, things like that. Another thing that can happen is if you don't have, like, if rivers are very like stagnant or like not super clear, they're really junky. There's a lot of trash in there, things like that. It's not going to flow properly as well. So, if you've ever seen just like wide riverbed, and then there's like this little teeny tiny trickle of really like brown water that like is barely trickling through, like, that is a type of thing that can happen within your body and start causing other symptoms like brain fog, bloating, things like that. And it could be, like we said, layers. It could be both
So
of
you're
them.
kind of saying like we have these, what they call meridian channels, correct?
Yep.
And that they're connections through our bodies that are similar to a river, or even our blood flow that flows in and out, right? And that when there are things, and I know you kind of mentioned this earlier, that mind-body connection. So when there's things both physically and mentally that are affecting us, they kind of block, disrupt, or change the natural flow of the energy in your body through these channels.
Yes, that's a very beautiful way to put it.
Okay. Awesome. And so what I'm hearing you say too is that so acupuncture is a way of healing the energy channels and opening them back up and allowing them to, do what they're supposed to do, in a way that sometimes we're not able to do through Western medicine or therapy or things like that.
Exactly. So, so what acupuncture does is it reminds the body, or it helps the body kind of roll that boulder that might have fallen in out of the way, and it kind of helps with that cleaning process, like you were talking about, of clarifying the water that's running through the river, the energy that's flowing through the channel, however you want to look at that. And it just reminds the body what that original state of health was, because the body does remember, but it trying to think of how to phrase this, as we kind of compensate for other symptoms that we're having, we kind of have to like unpeel the onion a little bit. And so I tell people acupuncture is a very cumulative process. So the more you do it for longer, the better you're going to feel for longer. So a different way that I have been explaining it to clients recently is within your body, you have your digestive system, and then you have your kind of like your genetics and your they call prenatal chi, or your prenatal essence or whatever. So it's the energy that was given to you in as you were growing in your mother's womb and things like that. That is like your so your digestive system is like your checking account, and your prenatal essence is like your savings account. You want most of your withdrawal deposits and withdrawals to go through your checking account, and then you always save your savings account for emergencies. And so what can happen with this extra and there's lots of things that can affect your digestive system and your checking account, if you will. But the more depleted that is, the more that you're going to draw and tap into that savings account, which is tapping into the adrenals, like we were talking about, and that can cause adrenal fatigue. And so when you've tapped too much into your savings account and you're not like replenishing the checking account and like kind of re-adding back to that savings account, that's when you're going to hit that that just like overwhelming fatigue of I can't do anything because I don't have physical or mental energy to do it. Does that make sense?
Yeah. And I want to touch on what you said about that prenatal chi, because I think some people are going to be like rolling their eyes like, what the hell? I don't believe this.
Probably.
And the reason I wanted to touch on that was that there are a lot of new evidence coming out about generational trauma. And there is scientific literature that does support that we basically carry trauma and negativity that's happened throughout our generations in genetically through, and that can affect us as an adult, and things that happen to your mother while you're being formed in her womb can actually cause you trauma and issues as you grow and are an adult. And I just wanted to touch on that. That's not necessarily this crazy idea out there that we do in the scientific community have studies that support that idea.
Yeah, I'm glad you touched on that. I've heard the term generational trauma. I didn't know that there was, that they were doing actual studies on that. But yeah, it's a similar way of saying, like, the genetics that were given to you in whatever form that came in is that that prenatal essence or chi, or however you want to phrase it. So yeah, so there are things that can affect you even before you were born without your knowledge, and things like that. So so the more that we can kind of save that that savings account, or that like adrenal reserves, the better our health is going to be. And so you don't kind of hit that burnout place, because it can be really, really hard to pull out of.
In acupuncture, does that help replenish that? Is there a way you can replenish that?
It is tricky. You kind of have to start from like more of like lifestyle changes. So like, eating healthy and clean foods, figuring out ways to reduce stress, whether that's through acupuncture, whether that's through therapy, whether that's changing relationships or setting boundaries, being in therapy, exercise, medical qigong, or meditation, things like that. So not that you have to do everything, but finding what works for you will start to replenish that savings account. But it's also going to replenish the checking account, if as well, if if you're eating healthier, if you're better hydrated, if you're sleeping better, things like that. It will kind of replenish both at the same time. And so acupuncture can do that. There are certain points that will like replenish that energy. There are points that will help alleviate symptoms. And then one of the modalities that I use, I don't do it as often, even though it's my favorite, is moxibustion, like we had been talking about earlier. And it's one of the few ways, other than food, that we believe you can put energy into the body.
So explain to our audience what that is, because in case y'all were wondering, we were talking about this before we started, and I had to ask because I've not heard of it either. So tell us what that is.
So moxibustion is the fuzzy stuff that comes off of the leaves and twigs of the mugwort plant, or the artemisia plant. And there's lots of different ways that you can apply it to the body. It's very soft. I don't think I have any in my kit right now, but it's very soft, and you can press it into small cones and apply it directly to the skin. There's a different form that you can, like, if you put an acupuncture needle in, you can put a little ball on top of the needle. They also come in like these long cigar looking things, and you can just kind of light it and just hover it over the point that you're trying to work on. And so you light it. It's not like a candle is lit. It's more of like an incense type thing is more like smolders, I guess. And then you can put it on areas of the body. You can put it on specific points, and it doesn't feel hot. It feels more like just a gentle warmth, kind of like you're laying on the beach in Mexico kind of sensation. It's really good to help with digestive symptoms. So diarrhea, bloating, excess gas, abdominal pain, things like that. It's really good to help with painful menstruation. It can help with if you're ever injured, especially if you're like injured in like rainy weather or cold weather, and that injury always acts up when the weather changes. Mox is really helpful to help warm that area. I also use it on the face a lot when I have patients come in with Bell's palsy. It just kind of warms the area and kind of opens up those, kind of wakes up those muscles, and kind of calms the nerve pain and things like that. So there's lots of different ways you can use it. But one thing also that is really helpful is to add it, and it will really help with your energy, because you're adding it both to that checking and that savings account that I was talking about.
So tell me this, because I understand acupuncture probably more than the average person, but I'm not an expert like you are, Amy. And so we're talking about that we have these meridians, which are energy flow lines, and because of things that happen, they get disrupted, and don't flow the way that they're supposed to. So in my mind, I'm pretty logic. If Tell me how putting a needle into that energy line actually opens it up, because when you, in my mind, right, like in most things, if you're putting something in front of something, you're blocking it, you're not
Mhm.
opening it. So kind of tell us how that works.
So one way that I've heard it described is it's kind of like each point is like a little like water balloon, if you will. And so it's got energy in that area. You know, if you fill a water balloon, it's got the energy of the water in that water balloon. And so then by putting that needle in that water balloon, it kind of opens it up and kind of releases that energy into the area um around it. Now it's not going to like, swell like a water balloon, but like that's kind of the idea of it. And some people feel that opening in that area. And sometimes it's the opposite of like there's so little energy in that area that it's kind of like it's almost like barren. And so by putting that needle in that area, it's kind of calling attention, like, hey, we need help over here.
Like
And
send
so
the troops and the energy starts flowing back.
yeah. So it's and I know that that still is a little bit more of like a woo woo way to think about it, but um, you know, some people talk about it's like, endorphins working of, you feel the needle go into that spot and it, releases endorphins, or it releases other, neurotransmitters to help things calm down or whatever. But that's kind of it's a little bit, it's not exactly for me comparing apples to apples. Like
Okay.
so yeah.
So, I'm afraid of needles, in case anybody out there wants to know, which is probably surprising because I do IV therapy and things like that. I actually passed out and gave myself a black eye one time.
Oh, no.
So, I think I told Brianna this when I came to see her. So, tell me, like, what is the needle like for people who don't understand that and have, I think almost everybody has a little bit of fear of needles. Most of us,
Yeah.
nobody really, I mean, there are some weird people out there who enjoy it, but most people, that's not their choice. So tell me, what are some things that you would tell somebody like me who's afraid of needles, who's like, oh, I really wanted to try acupuncture, but I just don't think I can get over the needle thing.
Yeah, that is a very, very common reaction that I get is, I hate needles. I'm not ever doing it. And I get that. What I tell people is the needles themselves are very, very thin and flexible. They're about the width of a cat whisker. So I have some over here. So like, I don't know if you can see this super well, but like this is,
Yeah.
yeah. So like, I mean, you can't even really see the actual like needle part of it. You can kind of see the handle right here. But and this so this the handle is what I touch. The flexible part is what goes into the skin. And so this is what I'm working with. It's basically a cat whisker. There's a picture that you can look up on the internet that is how many acupuncture needles fit into a like a hypodermic needle that you would get a vaccine or a shot through. And I counted, I think it's like 28 or 30. Like
Oh, that's a lot.
yeah, they're so thin. And so I tell people like you might feel them going in. They're still a sharp pointy metal object, but once they're in, you might feel nothing. You might feel like a heavy sensation. You might feel like a dull ache, that kind of thing. But nothing should be like so strong that like you're only going to focus on that for the next half hour. If anything hurts, if anything is like really uncomfortable or sharp and stabby, like I don't want that. And so I want you to tell me so that I can adjust that. Like this should not be a painful experience, in my opinion.
And just so we all know, the needles that you use are sterile needles, correct?
Yep.
And we don't reuse them.
Nope. But
Right.
sterile, stainless steel, filiform needles, single use.
If
So
you're going to an acupuncturist, that's something that you want to ask them or check, right? If it's not you, like, what are you using single use needles? Can you
yeah,
show me so that you have confidence and comfort that they're putting something in your body that is clean,
absolutely.
and it's
Yes,
not going to cause you an infection or anything like that. So
absolutely. Yeah,
I think
we
that's important because I think people kind of sometimes they don't always grasp that concept.
right. And I think acupuncture safety has come a really long way. Like, they used to use like needles made out of like bone and stone, like, long, long time ago. And then, it used to be before we knew a lot about, um, you know, transmitting diseases and infections and things like that, there would be, if you'd go to your acupuncturist, they would have your file, like you have at your doctor's office, and then you would have like a set of needles that they kept in an envelope in your file. So you would only have your needles, but they wouldn't be like single use and sterile every time. And so now, part of our training is we have to get certified in clean needle technique and so that we know, how to properly, use and like act within the treatment room so that we're not contaminating things. So we're not, spreading disease or infection or anything like that. So, it is something that we take very seriously because.
So I have a question, like, say I have somebody who has shingles, right?
Mhm,
And that's on the skin.
mhm.
Um, but they're having a lot of pain.
Yeah,
Is because that like the skin is disrupted and sometimes weeping and the virus can be transmitted. Is that would you do acupuncture in an area like that if needed to alleviate pain? Is that something that someone can go have done, even if they have like open wounds or rashes or anything like that?
definitely. So I have had patients with shingles come in before, and I'm not going to put needles in like directly into the area that is, like an open sore or weeping or anything like that. Um, Something that is really effective is to kind of like map out where the rash is and then just put needles kind of around that, because that like releases a lot of um the for me, I call it like the heat and like is what's causing the pain of it. But I'm not going to like needle directly into that rash. Or if someone comes in with an open wound, I'm not needling directly into that. A lot of what I do is I work on the points that from elbows to hands and knees to feet. And so, even if someone is having a shingles outbreak, I'm trying to think of, like, let's just say like it's all over like, one side of their body. There are a lot of points that I can do on their legs and on their arms that will help decrease pain, alleviate itching, calm the rash down, things like that, without having to go near the skin issue itself. I would also probably wear gloves, just in case, both to protect, that patient, myself, other patients, things like that. I also change sheets in between every patient. So even if they're, laying directly on the sheet with, a skin disruption, it's not like someone else is going to come lay right on top of that in the next session. So, yeah, I do take patient safety and cleanliness really seriously.
Awesome. Oh, and I also just want people to know in general, like if somebody's watching this video, they can't get to you, and maybe they would need to vet an acupuncturist somewhere else. Like, what are the things that they should be looking for to ensure that that's a safe place for them to get the therapy from?
Yeah, I would also make sure that I believe in 40, when I was in school, it was 44 states. I think it's 48 now. That in order to practice acupuncture, you have to pass licensing exams and be like a certified acupuncturist. Behind my name are the initials LAC. And so like looking for someone with that designation would be important, or making sure that they are the accurate or the abbreviation is NCCAOM, which is our like national certification board, making sure that even if it's not LAC, as long as they're NCCAOM certified, that means that they've gone to a reputable school, passed their licensing exams and things like that. So that's just something else I would look for if they're, not coming, if they're out of state or not coming to see me specifically.
Awesome. So I decided to come. I think I have adrenal fatigue, or I'm just tired, and I've seen my doctors and nobody can help me and tell me. So I come to you, and you kind of do similar to me, right? You have an intake where you go over symptoms and medications and things like that. Are there any contraindications to getting acupuncture that would be like a hard stop, like any medications or other things that would be like acupuncture is not for you right now?
Not particularly. What acupuncture is really great at is you can use acupuncture as, a way to kind of like treat what ails you in a lot of different senses. I'm not considered a primary care physician, so like, you can't come see me once a year for your annual exam, but you can use acupuncture as a predominant way to treat different things. So, if you've got headaches, if you've got back pain, if if your sex drive is low, if you're stressed, like there's lots of different things that acupuncture can treat. And so you can use that as more of a predominant way to treat what's going on in your body, but it can also be a really nice complement to other things that you're doing. So if you're wanting help with your let's just say you're feeling depressed, you go on an antidepressant, anti-anxiety medication, but you are still wanting some support with energy or with sleep or something like that, acupuncture can still support you in that. It's not really a I can't help you kind of thing. I will say, if you fall and like break your arm, please don't come to my office. Like just go to the ER. Because if I break my arm, I'm not going to my acupuncturist. I'm going to the ER and they're going to set my arm. Like, if it's an emergency situation, if it's, like if you break something, that's not a call your acupuncturist moment. But, you can do acupuncture to support you as like you're going through chemotherapy. You can support do acupuncture as a support if you're doing any kind of like fertility treatment like IVF, or you can do acupuncture if you're feeling great and you want to stay that way. Like, acupuncture can support you no matter where you are in that journey.
So if you're taking a blood thinner, can you come and get acupuncture?
It's just something I need to know. And, occasionally, and this can happen whether you're on blood thinners or not. Sometimes, when I take a needle out, there can be a little drop of blood that comes out. But usually it's like you put a cotton ball on and it's fine. I just need to be aware of it so that I can, make sure that, we put extra pressure on that cotton ball. It's not really, if you're older and on blood thinners and your skin is thinner, I would not do cupping on you. That's just too strong for thin skin and on blood thinners. But you could still come get acupuncture if you were older and on blood thinners. So
is there any medications that might hinder what it does for you? Because I know in certain modalities that deal with energy, for instance, transmagnetic stimulation of the brain they use for depression and anxiety, there are certain medications that they recommend you not taking because it can interfere with the outcome. So are there any like groups of medications or families or ones in particular that you've seen in your practice or you're educated on that could affect how you heal or how beneficial it is for you?
That is a very good question. Not as far as I'm aware. I think there are certain medications, like probably more in the potentially more in the like antipsychotic range, that just like or depress your system so much that, I do fully believe that, doing acupuncture is still doing good in your body, but you yourself might not notice the benefits as much. So, I remember I had a patient in clinic in grad school that I think she was on lithium. I can't quite remember. She was on one of those really strong antipsychotic medications, and she had done acupuncture before, and so she knew that about herself, that she needed a lot of really strong stimulation from the acupuncture needles in order to feel like she got a good treatment. But that's kind of the only real experience that I have with it. I of course want people to feel better and more like themselves and things like that. So there might be some medications that are just so strong that even though I know that it's doing good in your body and for your health, you just might not notice the effects.
Okay.
But nothing specific beyond that.
All right. So we come, you've screened us. We don't have any, we have some issues, and now we're getting ready. So what do you then do for me?
So the way that, kind of a new patient session works is, you come in, we talk about why you're here, the history behind what we're working on. I might ask a lot of follow-up questions. I might ask some really random seeming questions. In acupuncture school, we lovingly call that intake the 10,000 questions, because it feels like it. And we kind of just do a whole review of, all of your body systems. And then I do, it's important to me to have my patients educated on how acupuncture works and what is going to be happening, what they should be feeling, things like that. And so, I do kind of a short version of what we've kind of talked about, of the river analogy, and, what the needles should feel like once they're in, what they can expect, during their treatment. And then, once we've kind of talked about all of that, we'll get you on the treatment table, and we'll do, usually that first treatment is a little bit shorter, just because there's so much information we have to get through. One thing I hadn't addressed, earlier when we were talking about people's fear of needles is, I'm not the type of person to be like, well, this is your treatment, and so this is, whether you like it or not, this is what we're going to do. So if someone's super scared or phobic of needles, I can start with 4 needles and see how it goes. And if you're like, that's it, that's all I can handle, then we stop. Or if I, get to needle 3 and you're like, I can't do this, then we take them out and we're done. So I really believe in, following the patient, letting them call the shots and listen to their own body, and kind of trust what their body is telling them is what they need. So, we start with 4 and see, if they do okay with that, whether it's that treatment or the next treatment, we'll add, a couple more needles. So it doesn't have to be like, well, I wanted to do 10 needles and you only let me do 4, so your treatment didn't work.
It doesn't have to be all or nothing. Even
exactly. Right? So
how long does the needle usually stay in?
As much as possible. I like the needles to stay in for as close to 20 minutes as possible. The reason for that is it takes 21 minutes for the energy to go through all of the energy channels one time. So it just allows that, the body to reset and do what those acupuncture needles are supposed to do. And how often do we get to lay in a quiet room with nobody bothering us for 20 minutes at a time? So
I think most of us aren't even sure what we would do with that 20 minutes.
Right? Yeah. So and so that time is time for the energy to start moving and shifting and doing what it needs to do, and for you to just kind of lay there and relax and rest, and then be able to kind of take on the rest of your day.
And then tell me, how should I feel at the end of a session? What are the different ways people feel? Are there residual, you don't feel anything, but later you feel something? Kind of, how does that work? So I've had my session, you put my needles in, I laid quietly, and now you're taking them out and I'm getting off the table. How should I feel?
Um, so there's a few different ways people can react. Some people get off the table and they feel amazing, particularly with my patients who come in with musculoskeletal pain. Ideally, that's what I want for them, is if, at least for them to be like, oh, I can, bend over more than I could when I came in with my back pain, or it doesn't hurt to put as much to put my weight on my knee as I did when I came in. I want to see some kind of improvement, particularly with musculoskeletal pain, pretty immediately. It doesn't have to be, but ideally. Some people will get off the table and maybe feel a little bit better, but they won't really notice the more full impact of their results until about 24 hours later. That's usually how I experience acupuncture, is like, yeah, I feel better when I get off the table, but it's that next day when I'm like, oh, I feel so much better. That's what I needed. Occasionally, and this happens more with patients that have really high anxiety, but it doesn't even typically happen as much with them, is you might notice a flare up of your symptoms for about 24 hours, and then it should decrease after that. I think it's maybe happened like twice that I know of, that people are like, I had such a bad anxiety flare up overnight or something like that. But I always tell people, if you have the flare up of symptoms and it doesn't go, kind of decrease after that 24 hours, to please call me, and then we'll get you back in and really calm you back down.
Okay. And then it sounds like to me also, like, it can benefit you like acutely for like an immediate need, but the more you do it, it has an accumulative effect.
Yes. So it is very much the more you do it for longer, the better you'll feel. The other piece of it is that I don't want people to feel like they have to come in, to my office once a week for the rest of their life, kind of thing. My goal for every patient is I kind of front load their treatment, so see them more consistently, early on in our working relationship. And then as they feel better and their body is able to hold on to those treatments for longer, like when you used to come in, you could hold on to a treatment. And by that, I mean, like, you might notice that you sleep better for, a night or two in a row. And then as we continue working together, you'll start to sleep better for 3 to 4 nights after your session. And then eventually it's like, well, I've been sleeping well for the last 10 days. And so like, once your body's able to kind of hold on to that treatment, and you'll see results for that whole, for most of that time in between sessions, then we can start stretching those treatments out to every other week, every 3 weeks, things like that. My goal for every patient is to get to the point where they can kind of come in once a month for what I call a little tune-up treatment, and just kind of keep you feeling good. And then, we'll see in a month, kind of thing.
That's kind of what I was going to ask you. So that frequency in the beginning, is there kind of, that most people come like 3 days a week, like, finances aside, if money were no object and you could come just based on your need,
Mm-hmm.
or does that more have to do with what they're there for?
The more acute something is, I would, money and like timing aside, I would want people to come in, probably at least twice a week for probably 3 to 4 weeks. And then we can start, stretching it out a little bit. If something is more chronic or more internal, I'd probably say about the same. The more chronic patients, though, it might have to be a little bit longer, of coming in more frequently. If it's something like
The longer you've had something, right, the
yes.
longer it takes to unwind. I always try to remind my clients that same thing, right? Like, you didn't get
Yes.
here overnight. So
Yes.
as much as I'm going to help you, I'm not going to fix you overnight, right?
Right.
It's
So
usually
true.
going to take half. I think in medicine and some of the things I do, they say for like every year that you've had something, it's going to take 3 to 6 months to heal from it.
Wow. Okay. I think, yeah, I think mine was, for every year you've had something, it takes a month to like unpack
Yeah.
that. So, but it's, I mean, it is still definitely a long haul thing. You know, if it's something like you woke up with a cold, you know, acupuncture can really help decrease the length and severity of those cold symptoms. And so if like, you know, you call me, like I woke up and I am super stuffed up and I don't feel good, and you can come in like that day or the next day, that can really help just, I say blast that cold out of your system. But if it's something like, I don't know, you've had constipation issues since you were 6 and you're, you know, 26 or whatever, like that's going to take some time to really, you know, work through and you know, help your body heal from all of that. Like those are two very different scenarios. So
Awesome. Can you do it every day? Is there ever a scenario that you would come every day?
um I don't see why not. To me, I do think that sometimes the body does need a little bit of time in between sessions to kind of recalibrate and be like, okay, you know, this is the message that I received. I now need some time to like, you know, work through that. So I probably wouldn't ever tell anyone to come every day, but it's not something that typically you can like overdo. So, you know, if it's something like if you have a really weak patient, you know, that maybe does have like severe adrenal fatigue or you know, has I don't know, just maybe like a someone who's recovering from an eating disorder kind of thing like that doesn't have a lot of reserves, that might be, you know, someone that you have to be real gentle and real slow with at first. But yeah, it typically in general, there's not something that I'd be like, you're getting too much acupuncture.
Okay. Well, I also think it's good, like, you know, if people are going to go to somebody and they say, oh, no, you need to come in every day so that they know, you know, there may be a reason behind that, or that's not, you know, average treatment for most people.
Right.
And they should investigate that. So you have acupuncture thing that you're going to teach us to do on our own?
Yes. So I sometimes I'll do this with clients like just as a way to um be able to further their treatment at home. And you know, if they're like as I'm doing a session, you know, if there's something that I want to tell people about why I'm doing a specific point or what that point is doing, you know, for their body and things like that, they like it kind of helps to kind of have that seed planted of like, okay, you know, this is why she's doing what she's doing. So this is kind of a general anxiety stress treatment that I do on a lot of clients, and it's really helpful just to kind of like ground the system and settle the system. So what I do, a lot of stress and a lot of anxiety is about too much energy going upwards into your head. And so what I like to do is start from the top of the head and then work my way down. And so what I do is at the very like crown of your head. So if you put your fingers on the tops of your ears and then draw a straight line up to where they meet on your head. So that's, you know, basically the crown of your head. Yep.
Am I in the right place?
Yep. Just right there. If you kind of press on that, or, you know, you can press, you can tap, you know, you could even just hold that point, but, you know, some kind of stimulation to that point. That point is called 1,000 ancestors. And so it's the closest point from our, you know, from us kind of up to the heavens. So kind of opening up and stimulating that point is kind of inviting the wisdom of 1,000 ancestors in. So what that's helpful for is like memory issues, or if you've got like a monkey mind, like racing thoughts, your brain can't turn off. That's a really good point for that.
How long do you hold it?
It doesn't have to be super long. Like you can, you know, tap it or hold it for, I don't know, 15 to 30 seconds, but
And
it
can you
doesn't
do
have to be
that
long.
anywhere? Or do you want to be somewhere you can close your eyes and be calm?
It can be anywhere. Like if you're, you know, if you're in the middle, like my acupuncturist would do that before I went and took finals. And so she showed me where that point was. And so like, as I was studying for it, I would just kind of, you know, like tap that point to help my memory with while I was studying for finals.
So I'm just going to tell everybody I'm doing this exercise and I have really bad TMJ. And when I pushed at the top of my head, I actually felt my jaw relaxing.
Oh, cool.
I just wanted to share with everyone that this does actually work. And just so you know, I've never done this before.
Cool. Cool. I love hearing patients
So
experience with that.
sharing with you all that does work.
Okay, great. I'm so glad. The next one that I like to pair with this one is kind of that third eye point. So right in between your eyebrows. So like putting those two together is really, really good for calming your mind. You know, if you even like, if you rub this point on like dogs or babies, like you'll just kind of see their eyes just start to float closed. So this is a really good point for, you know, calming an overactive mind, calming if you're just really stressed out, things like that.
It doesn't mean that you're just exacerbated, right? I think
Yeah,
my mom
you can do that too,
She's like tired of me talking to her. She'd be like,
yeah. I mean, if you're exacerbated, then you know you do need to calm down a little bit. There's another point that I really like to do. A lot of times when people are feeling really stressed or anxious, they're not doing a good job of like taking a really full deep breath in. You know, like whether it's, you know, into their belly, like they're just breathing very shallowly or they kind of forget to breathe. And so what that can cause is feeling either like a constriction in the chest or like a really heavy sensation in the chest. And so there's a point on the sternum that it's in the fourth rib space, but basically you know, it's kind of like right in the middle of the sternum, kind of in between where, you know, kind of like where your nipple should be.
can
So
you
kind of
count,
maybe
right? Here's your clavicle. So
mm-hmm.
one, I don't know if you can see mine, two, three, four. So
Yep.
right here.
Yeah,
Okay.
that point is tender on a lot of people.
Yeah, I feel tenderness.
Yeah. So you know, pressing on that point should really just open up your chest, kind of, you know, allow yourself to take a really deep breath and kind of just have that cleansing moment of, okay, I can breathe now. And the last point, I'm not going to show you exactly where it is because it would involve looking at my foot and that's weird. But so if you pretend that my hand is my foot.
Okay. You can look at my foot.
Okay.
Let me to make sure my feet are clean. Okay.
I did shower this morning, but yeah.
Okay. Because I mean, we have to get some entertainment here. So here's my foot.
Okay. So in between your second and third toes.
So here.
Yep. On the bottom of your foot, you kind of roll over the ball of the foot. Yep.
Here. Okay.
So right below, yeah, right over the ball of the foot. That is the lowest point on the body, and it's really good for like grounding that energy. So we started at the top to kind of like, you know, open our minds and relax our minds. We also need to bring that energy all the way down. And so pressing on that point is really good for bringing all of that excess energy that's up here when we're stressed and anxious all the way down to the bottom, you know, to the bottom of the body, and be able to kind of give us that like clear, cool head that allows us to, yeah, be able to think clearly, to be able to.
Am I in the right place?
You are, yes.
Okay. So everybody can see where that is because I don't think you want to look at my feet anymore.
So this is really great for if you are not sleeping well. This is a really good point for insomnia. If you are feeling really stressed out and like season and, you know, location permits, like going and walking barefoot in the grass is really helpful just to kind of ground all that energy. You know, you could also do, if you're not sleeping well, if you're really stressed, you could also do like foot soaks. And that, you know, is kind of treating that area and that point just to help, just kind of give you a sense of like, okay, I am standing in my own 2 feet. I can handle this situation. I don't need to get caught up in all of the noise up here. You know, I can kind of resettle back into my own body. So, so those are just a few of the points that I do for, you know, high stress, high anxiety patients. There's lots more that I do, but those are just some easy ones people can do at home.
Well, thank you for sharing those. I mean, I think it's always helpful to anytime we can have some extra tools in our toolbox to help us be more grounded and kind of calm that monkey brain and the stress and anxiety that we have, whether we're dealing with illnesses or just modern life, which is
Yeah.
stressful in itself. So thank you very, very much, Brianna, for giving
Thank
us
you.
a really great history on acupuncture and how it can help us. And just so y'all know that Brianna is with Full Circle Acupuncture. I can't.
Good.
And you're located in Littleton, Colorado, correct?
Yes, I am.
All right. And we will have all her information at the end of this recording so that you guys can reach out to her. And I highly suggest that you reach out. She has lots of things to help all of us, from illnesses to stress to, whatever kind of a lot of different things, really and truly, in your healing journey or just your journey to stay healthy. So, thank you. I'm Leah Hughes with Mountain Roots Holistic Healthcare, for joining us today and learning more about acupuncture.
Thank you, Leah, for having me.
You're welcome.